Hello, precious. Oh my gosh, look at you.
We checked all of our squirrel gliders this morning and noticed that Honey had a bit of a swelling just on the lower left side of her face along her jawbone.
Honey is a tiny little creature, so delicate and unfortunately can die without trying at all. You just need to go back to your basic skills. Your patient needs to keep breathing and their heart needs to keep beating. Hi there,
Hi.
how are you doing?
Hi. Nice to see you.
And you, do you want to come on in?
Sure, thank you.
Scott's next patient has arrived with Meg, the wildlife manager at a local native fauna park.
So, what's been happening?
So this is Honey, the squirrel glider. This morning we noticed that she's got a small swelling on the left-hand side of her face, and it looks like she's got an infected tooth right at the back.
Okay. Wow, it's so little.
Yeah, she's tiny.
She's so light. Hello, precious. Oh my gosh, look at you.
We checked all of our squirrel gliders this morning and noticed that Honey had a bit of a swelling just on the lower left side of her face along her jawbone. It wasn't noticed yesterday, so I'm hoping it's only just started and we've caught it early enough that we can get it treated without too much discomfort for her.
Wow, she's so beautiful, isn't she?
She's gorgeous.
Exquisite markings. Wow, hello baby. How are you? Popping out of the little bag, Honey, just this vision of gorgeousness. She's got these beautiful big eyes. Of course, she's a nocturnal creature. Seems also quite confident. She's amazing.
Yeah, she's pretty cool. Honey is friendly and placid with the keepers at Karanda Koala Gardens. She's very happy to be out and about with us when we're feeding her. Squirrel gliders do exactly as their name implies. They glide. They will start from one tree and be able to, like a kite, catch some air and glide to the next tree. So they don't fly by any means. They don't actually gain any height. They do glide in a descending manner.
So how far can they glide from tree to tree?
About 50 meters if they start high enough and they have enough open space. So they use their wings, if you want to call them that. The large bits of skin connect from the back of their hand to the back of their feet, and they use that to glide from tree to tree.
Oh, good girl. Let's see it. I love Australian wildlife. When I was 7, I was camping with my parents in the outback, and a small rodent touched me on the finger, and it was this sort of almost religious moment where I just went, this is what I want to do. I have an affinity with animals, and I took it all the way to being a vet. Now I can see that swelling very clearly, so just under the eye, on that right-hand side, right?
Yeah, her left, your right, yeah.
So has she still been eating normally?
She was eating yesterday. Yeah.
What do you feed these guys?
A bit of fruit and a little bit of hard veg, and then they also get a variety of browse, so we give them eucalyptus and fig.
The possibility is that she's got an infection around the tooth, also maybe it's some sort of foreign body, maybe a bit of the vegetable material that she's eating.
Yeah, it is a possibility that she's had to chew on some of the browse and maybe a stick or something's gotten stuck.
The likely causes for the swelling on Honey's face is a tooth root abscess. So either there's a damaged or dodgy tooth that needs to come out, or there's something stuck between the teeth. Either of those things cause infection, leads to pus, and that's the swelling that you see. Hey, Kath.
Hi, how are you doing?
Hi, good. So I've got little Honey, the squirrel glider. She is unbelievably gorgeous. Here we go. Just have a look. When you see this girl, she is just magic.
Oh, hi, beautiful.
Isn't she just magical?
She's stunning. You can see the swelling on her face.
That's it, yeah. And that's the issue that we have to address today. So we'll give her a little bit of gas.
Yep.
Wait until she's nice and sleepy. I'll have a look into the mouth. We'll see what the problem is and we'll go from there.
Perfect.
Sound good?
All right.
Yes.
All right, sweetie. Put a little nose in there. There we go.
This is the first time Scott's treated a squirrel glider, and dealing with such a delicate native animal is making him more than a little nervous.
All right, you happy for me to put the gas on?
Yes, I am. Yeah. Come on. It's really difficult to manage the anaesthetic of a little creature like a squirrel glider. When they're that little, they have a very fast metabolism, so they absorb the anaesthetic quickly and then they throw it away quickly as well. So they wake up then they go back deeper. And so trying to get the job done in between those quick highs and lows is really tricky. She's getting there. Yeah, she's nearly there. So, good girl. So she's getting a little bit floppy there. It's hard to build up on that back molar. Just trying to see if that tooth wants to actually come out.
Scott needs to take a closer look at Honey's tooth to decide if it needs to be removed.
Jail bars right in the front of the mouth there just makes it tricky.
Yeah.
But the shape of the 4-year-old marsupial's mouth is making the job almost impossible.
The anatomy of the squirrel glider is quite challenging, very long, pointy in sizes, kind of jail bars getting in the way of what I need to do. So it does make it really difficult to navigate around the oral cavity. So access is proving quite difficult in this guy.
All right, sweetie. It's all right.
Suddenly, the tiny patient begins to stir.
Honey is giving us constant frights, going deep into the anaesthetic, and then would virtually stop breathing, and then she would wake up because you took the anaesthetic away. It really is quite a difficult day at the office. Just wondering what we should do to just monitor her heart rate. Honey is a tiny little creature, so delicate, and unfortunately can die without trying at all. You just need to go back to your basic skills. Your patient needs to keep breathing and their heart needs to keep beating. All okay?
Breathing's good. Heart rate's great.
Amazing. Okay, perfect.
With Honey's vital signs back to normal, Scott discovers the cause of the fragile little creature's swollen mouth.
Oh, yuck. There's a massive build-up of fluid just here. So it's definitely an abscess. I can see that the molar at the back of her jaw is actually fine. I crack a bit of tartar off, but there's no issue of root decay. But further back, there's this sort of cheesy pus that's present there. And although I'm using cotton buds to try and remove the pus, there's still a big, large lump of fluid that needs emptying. Gosh, yuck.
There is a lot of infection in there.
Once again, the peculiar shape of Honey's mouth is preventing Scott from getting enough access to the infected area.
There's definitely a hole down the back there where all this pus is coming from. So I think what we'll do, I might just put a tiny little incision just underneath the chin and flush it out that way. As a vet, you need to be light on your feet, and when you can't perform a procedure one way, you need to come up with a solution. So as I can't get the pus out of her mouth, I know I need to go from underneath to try and relieve that pressure of this abscess. What it means now is I need to perform a lancing of the area, basically using a scalpel, very carefully applied through the muscles and the nerves and the blood vessels of that area, and then allow the pus to run free and escape that area. Oh, wow. That is disgusting.
Oh
Look
gosh,
at that.
so much infection.
Oh my God. As soon as I lance it, a torrent of nasty green pus comes flying out of Honey's face. How can something so cute produce something so disgusting? That is a huge amount of pus for a little creature.
Yeah, it's half the size of its head.
So glad we've done that. Okay. Oh, that's going to make such a massive difference, just that pressure relief. You can just imagine, she'll be like, ah.
Yes.
Within the pus is a whole bunch of toxins, and it actually really depresses you, makes you feel nauseous and sick. So now that we've got rid of that, that's going to be the start of Honey's recovery.
Even the swelling's gone down considerably.
Yeah, I can actually feel she's got a jaw again.
Scott gives the infected area a flush before starting the tiny squirrel glider on a course of antibiotics.
Okay, well that looks pretty good, I think. That face looks so much better.
It looks so much better.
Yeah.
Hi, beautiful.
Honey's face just all of a sudden changes to be much more sleek and slimline and perfectly balanced on both sides. So we know we've done a good job here, and it is just a privilege to be handed tiny-mouthed Honey. It could all go wrong, but it didn't, thank goodness. Meg will be here soon to pick you up, reunite you with your family.
Honey has made a rapid recovery from her surgery.
Hi! Here's your girl.
Hello, honey. How are you feeling?
Yeah,
She
well,
looks heaps better.
Yes,
Great.
yes. She had the most incredible amount of pus come out of her mouth.
Oh,
It was really gross. It was a lot.
Well done, sweetheart. Hello.
You want to go back home, don't you, baby? Ah, that's so nice.
Honey looks so much better now. The swelling in her face is completely gone. So I'm really happy we can take her back home and just continue with some antibiotics for a few days and she should come good. It's great.
Oh, yes. I love you too.
But Honey's not ready to go home just yet. She's become quite attached to Scott.
Honey seems to be a little bit like Velcro with Dr. Scott. A little bit hard to get her off of him. I think she fell in love a little bit, has a little bit of a crush. Come on now.
She just loves her vet. What can she say, you know?
There we go, honey.
This little creature is absolutely stunning, and getting the chance to have a little play with her and a bit of a smooch is really pretty special. I wish she was gliding off into the sunset back to the UK with me.
If you guys loved that video, great. Make sure you subscribe to our YouTube channel below. That way. That way.